Monmouth Medical Center's Children's Hospital has within the hospital a regional newborn center, and that's where I work and my partners work. Our regional newborn center takes care of babies that are referred through the OB practices that come from both Monmouth and Ocean counties, pretty wide referral base. We have at Monmouth about 4,500 deliveries a year, and about 500, a little more than 500 some years of those babies will come to our intensive care nursery for services. The need for those services is quite variable. It may be prematurity, it may be term babies with other problems such as breathing problems, infections, jaundice, lots of different reasons why a larger, more near-term baby might need to come to the intensive care nursery. So it's quite a busy place. We were fortunate to have the Children's Hospital resources right at our fingertips. So we have subspecialty consultants, we have pediatric surgery, we really have all the things that we need to take care of most of these kids locally without having to send them out to other places such as New York or Philadelphia. If we do need other very specified services, we will access those places quite easily, and we have good relationships with those hospitals. So really the babies have a full gamut of services available to them. We've been members of the Vermont-Oxford Network, which is a national collaborative that does benchmarking and tracking of outcomes. We've been part of that since 1995, I believe, so it's quite a long time now. We have consistently been able to remain in the top quartile for outcomes in terms of survival, low infection rates, developmental outcomes, lower complications such as eye disease or lung disease. So we've been quite proud of the fact that at a community hospital we've been able to keep up with even the larger centers with different patient mixes and be able to have good outcomes. Of course, the technology has advanced quite a bit over the last decades. We have high-frequency ventilators, we have TPN, which is intravenous nutrition for the babies, different antibiotics available to us, imaging studies. So we really have a lot of things that we can bring to these children and help them to have the best possible outcome. I think one of the strengths of our group is that our nursing staff, our nurse practitioners, and the attending staff really treat these babies like they're our own kids. So we try to make it feel comfortable to the parents, make them involved, and make them be part of the process. It can be quite upsetting to have a premature newborn and feel that disconnect with your baby and feel like you don't really have, input perhaps as much as you would if the baby were healthier as to what's going to happen. So we try to work around that as best as we possibly can.